most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about extreme shoulder pain and arm pain gone instantly. Now we're talking about shoulder and arm pain coming from the neck.
Right, exactly,
So
Bob, which is not unusual.
Right, not unusual. A lot of times you do get the symptoms all the way down. But by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And yes, you're going to want to join us on our social media channels because we're always giving something away. Right, Brad? Yeah, we're giving away the RENPHO hand massager, cordless massager. I'm not sure what you call it. So,
well, it's cordless, but not handless. Anyways, it works nicely. It's great for getting some muscle tissue. Reciprocates.
Handheld massage, right?
Yeah.
Yeah.
Anyways, where can they get it, Bob?
Go to bobandbrad.com, go to the giveaway section, or go to Bob and Brad on Facebook and like us.
There you go.
Okay.
All right. So symptoms in the shoulder and down the arm can often be a result of a pinched nerve in the neck. And those are the cases that we're talking about where you can get some immediate relief.
If you do the right thing.
Right. We've got three options. That doesn't mean you're going to get immediate relief with one of these three, but it can. And as a therapist, when this happens, the patients absolutely love you, and they say, "How did you do that?"
That's right.
Yeah,
it's a good day.
Right. So we're going to show you some secrets that therapists know to help with these symptoms.
It's a miracle in the clinic.
Yes, it is. So the first one, okay, should we talk just a little bit? Why don't you sit down, Bob?
Sure.
Look at that. I just said, why don't you sit down, and he immediately did it. Do you act like that for your wife too, I bet?
Oh, I do. I listen to everybody.
So let's turn you this way.
Sure.
So the lower part of the neck is where some nerves come out, and they go down through the shoulders, down the arm, all the way to the hand. And this is the area where if a nerve can get pinched, you'll get pain, numbness, tingling, symptoms down into the shoulder, all the way down into the hand. And this is one of the things, as I'm doing my screening, I'll check the cervical area, and the first thing I'll do is I'll put a real gentle pressure down on the head. If they say, "Oh, that doesn't make anything feel any better," I quit doing it immediately. I don't push hard.
It might even make it worse.
Right.
Because you're squishing everything together, and if the nerve's getting pinched, it could be getting
pinched
worse.
Right. So I have the person sit up tall. I'll take my hand like this, go underneath the jaw. Say, "Bob, can you put your teeth together gently so that we have a good, solid mandible foundation?" This hand's going to go under the occiput, the bump right here, and I'm just going to gently pull up, up, up. I'll hold it for a few seconds. I'm going to go down, ask what the results are. Now, this is where, when the pressure is going on, patient will say, "Boy, when the pressure is on, my arms start feeling better." It'll happen just like that. Not always, but when it does, then you know you're on to something. You know traction is probably going to be a great option for treatment. So then we've got another one laying down, and also there's some other options. But I'm going to go to what I'll do next.
Cervical extension?
Cervical extension is a McKenzie technique. Robin McKenzie, a therapist who's really done a lot with therapy, and this is one of his techniques. I'll take a towel roll and put it there for support. And Bob, you want to lean back up against the chair, and we may do a gentle chin tuck. And I'll say, supporting your neck, see how far back you can look.
So I'm going to pull down a little bit.
Yep,
give
support there.
And I'm going to start to work my way back. Now, I may only get so far.
Right.
And it might start making the pain worse. That's fine.
Right.
Work in the area that it allows you to work. If it lets you go this far, do repeated ones just in this range. And this might be the first day. That's all you can do.
Sure.
And then eventually, hopefully, you can start going further and further. You want to be able to get as far back as you can. That's generally when the magic happens, as McKenzie says.
But I have had it on the first day, the first session. I'll have the person go like this, and the first time it kind of hurts, and they'll repeat it 3 or 4 times, and all of a sudden they say, "My arm's starting to feel better." If that's the case, then I say, let's repeat it more and more. We may do up to 10 or 15 repetitions. And if the neck starts to go back farther, like Bob is showing, and the arm is clearly getting better, and if you say the patient will say, boy, my fingers feel good now, all the way up into my elbow. Then that's a really
one thing I tend to do, Brad, is because let's say this is the bad arm.
Sure.
I'll grab with just one arm the towel too.
Yeah.
So
Yeah.
this one's not having to do the work.
Yeah, because I can kind of mask the symptoms a little bit.
So I'll do this. Sometimes I'll even do this.
Right.
I'll pull up like this and go.
Yeah.
That's gonna throw my mic off. But
as a therapist, sometimes if things are going really well, and they say, I say, well, maybe it'll work better if I'm holding on to this. So then
I've done that too.
And I'll do this. I don't recommend anybody at home doing that. That's just something that you need to be trained. You need some experience. However, and then the next one, I went back to this before, if the cervical traction shows some immediate relief in the arm, then I might have the person lay down on the table. And sometimes just changing position like this, getting the weight of the head going through the neck, the arm will feel better just from the position change. And it may or may not. What I'm going to do now is same thing as before. Seated cervical traction, I'm going to do supine, or laying on your back cervical traction. And I'm going to do that by putting my hand right here, again, under that occiput, the big bone right above your neck. And then Bob's going to close his teeth gently, and I'm going to come here and very gently pull some traction. And what I say is, because it's hard to talk when I'm doing this, Bob, if you have any problems and things are painful, just wave your hand or kind of say, yeah, thumbs are up if things are going good. So if I do this and I hold it for 5 or 10 seconds and thumbs are up, then I'm going to hold it up to 30 seconds as long as thumb stays up. And then I'm going to take it off, and I'm only going to do that again if thumb stays up. And I'll say, Bob, how does your arm feel now?
It feels better.
And then I'll wait a couple minutes. Does it still feel better? If it still feels better, then I may repeat that. Only doing it if it's clearly making the arm feel better. Again, sometimes it happens just like that. Other times there are some other options that the therapist has to work with.
And when I do this, Brad, my idea here is eventually we want to get to the extension.
Right.
I mean, I do this, especially maybe if the extension is not working right away to start off with. I'll do a little bit of this, and then I'll go back to the extension and see if we can do it now. Because the end goal, to me, to make this go away is to do the extensions.
Right.
I mean, eventually that's
typically when the arm gets better, the extension, the range of motion improves. So again, this can be one of those things that works out very well, very quickly. Other times you have to work into it a little bit. And oftentimes some of these things, you need an experienced therapist to do it. But
yeah, this will, give you the option of maybe seeking out a therapist that's trained in the McKenzie method.
Right.
And we actually have a video on that, on how to find a McKenzie therapist.
Right, because they're throughout the world. It's a worldwide system.
Yeah, 36 countries I think they're in.
I think it's up to 38 now. Could be more.
Sure.
But you type in where you live, and it'll pop up where these therapists are for you to.
So yeah, if you type in Bob and Brad and type in McKenzie.
Yep.
McKenzie.
I believe you're exactly right. Your spelling is getting better, Bob.
Yeah, all right. All right. Thanks everybody for watching.